questions also said if OT is necessary for a child who has speech delay. So me and Stacey discussed about this, and we actually have a lot of clients that we share together who are referred to Stacey first for speech delay, but eventually was referred to me as well because of some other issues. So if your child has speech delay, but if the child has some attentional difficulties or maybe some other sensory difficulties, then the speech therapist would flag that and then refer the child to us as well. So in order for your child to be able to sit through playing or practicing some language skills, they would also need attentional skills and being able to regulate themselves through that task, right? So these are some of the things that occupational therapists and speech therapists work together to achieve.
Yeah, I completely agree. So not every child who comes for speech and language therapy needs occupational therapy, just like not every child who perhaps has sensory processing difficulties also has speech and language difficulties. So we don't always need to see the children together. It's not always you have to do both therapies. And it would be quite problematic if you went to a centre who were basically pushing for that for every client, because that's just, it's not necessary. But when we do see some of those kind of like signs or flags, then like if I was to see something like if the child's quite inattentive, the child kind of does this if I touch them, or they really don't like touching certain items or things like that,
or they get overwhelmed from toy sounds.
And they get kind of overstimulated, and then they kind of then have a bit of a meltdown or something like that. Then at that point, then I would say, okay, I'm thinking that there may be something. And again, all I will say to the parents would be, there's a few signs that maybe they might need occupational therapy. I'm seeing, this. Why don't you just get your child assessed? It might be nothing, but I'm not an OT, so just go for the assessment, have the assessment. I mean, if you
to rule out things.
If you felt sick, you would go to a doctor, right? Even if you thought it's nothing serious, like you might just go to a doctor just to, rule out something else. So it's the same sort of thing. Like it's always best case, I think, to have that assessment and see.
And if your child doesn't need any therapy, like weekly or frequent therapy, we can maybe share some strategies that you guys can do at home as well, instead of committing to therapy straight away.
Which is actually the next question. Is there any work for parents to do at home? Which I think we kind of covered that just in our chat, and like we work as a team. Anything that we kind of do in our sessions, we do kind of expect parents to follow through at home. And we'll always give parents some tips, won't we? To the ideas of what you can do at home. So things like even take your child out to the park, let them explore some water play. If they have some sensory difficulties.
A lot of the general strategies would include playtime with your child and make it a consistent routine in daily life. I know these days that everyone's hustle bustle life, busy hustling, but it is also important for their development and for the relationship between parent and the child as well, to have that time. So a lot of the strategies would include that. And then if the child has some difficulties, some issues with their behavior, and then we would also share strategies to do at home, maybe with following sequence of activities. So you would tell your child like what do you expect your child to do, and then give them a sequence of activities, and let's do this, and then we do this, let's brush our teeth, and then we're gonna go wear our clothes, something like that. And then that fosters good behavior as well as maybe some more general strategies like positive reinforcement to do at home whenever your child is doing well with your request, and then positive reinforcement to follow through with that, what they did. So that's a good one as well. A good general strategies for parents to do at home.
And one of the things I like to suggest to parents is with some children who maybe are struggling to follow those auditory instructions is suggest, and I know you do this too, I'll just get it in there, is using visual schedules. Yeah, so we use like pictures, and we'll have kind of a picture board, or I have an app, and it basically it's like first we do this and then we do that. So you'll have the written format as well as the pictorial format, and this really helps to enhance the understanding of okay, this is what we're doing now.
Yeah.
And then you can do nice things like have them velcroed, so then once the task is complete, first we brush our teeth. Next, we put our clothes on. So once you brush teeth is finished. So then we take off and we put it in a pouch or something, right? And then it's a very clear visual of what's happening and what we have to do next. And this is done. Okay, I don't have to do that anymore. So I do advocate for parents to do use things like that as well. And you don't want to print out stuff. Then we have there's apps that you can use.
And then we would usually recommend the parents to maybe start with 2 activities first daily, and then gradually increase the amount of activities inside there. To further increase your child. Maybe make it at one point you can make it into a daily routine, have the whole routine on board, and then they would be able to follow that routine independently. You don't even need that prompting. They just wake up in the morning and they're like, oh hey, I know what to do. As long as you just prepare it. And actually, one of the things I used to do back in the UK when I did a lot of home visits was getting the parents at the evening before, so they can ready for the morning, is the evening before sit down with the child and kind of go through the next day's schedule. So then we're finding the pictures, and okay, so first in the morning we're going to brush our teeth or we're going to eat breakfast. Let's find out where is it, and doing making the schedule themselves. So then as well, it's not such a surprise in the morning. That you're kind of, because especially to really think about the children on the spectrum, they do need that routine, and they do kind of it really helps them to know what's coming next. With reading them in advance.
So
what they're going to
preparing them.
Exactly.
So that's one of the things I love to do with parents, if you can sit, if you do have the time. And it's nice to do it in the evening, when the child's getting ready for bed, or even if they're in bed, then you can just kind of prepare them and do it together, and then it's there for them when they wake up in the morning, and it's not a surprise. We prepared them, they know it's there, so now they know what's coming and they're able to follow.
Maybe in cooperation with story time, we will bedtime story before they go to bed, and then going through that routine to again prepare themselves for the next day.
That's a nice one. Okay, so I have a occupational therapy question. All right. I have a few occupational therapy questions. Are you ready? I'm going to grill you. I'll be nice. I'll be nice. So one of the questions is about the role of occupational therapy on behavioural issues and how can it help. I know we discussed this earlier.
So there was some behavior strategies that are already thrown out there just now. But again, it's really tailored to each child. So, and each child would need different behavioral strategies. So I would need to sit with the child, sit with the parents, trying to understand how do you react to the child's tantrums or behavior at home, and then try to understand that from their perspective, and then have some time with the child as well. I would try to maybe mimic the situation at home, and then see if the behavior also happens over here, and then from there we would be able to come up with some strategies that would be helpful to be used at home or at school by parents or teachers. And what are the kinds of behaviors that you see in your sessions? Maybe I could
help me. I have some children who if you give them a brand new task, for example, if it's something that they've never done before, they've never seen it before, as I just mentioned, sometimes children on the spectrum, they need that routine, they need familiarity.
Yeah.
One of the major kind of signs and symptoms, I guess, of autism would be that rigidity, right? So doing things over and over and over, doing the same thing over and over and over.
And not wanting, not keen to participate in new things.
Yeah, so one of the things I do sometimes see is if I bring out a new game, a new toy, a new activity, then they will maybe have a bit of a tantrum, or they'll throw it, or they'll push it away, and they won't want to engage in it.
Yeah.
And then it's quite hard, and you can see that they will do certain things, and maybe a bit of task avoidance.
Yeah.
Sort of things like that. I've had children have complete meltdowns, like throw themselves on the floor and run over to tables, pretend to kick the table, then complain like, "Oh, it hurts!" like drama.
Yeah.
And I'm just like, okay.
Just to avoid that.
Just to avoid the task.
Yeah.
So that's one of the big ones.
Yeah. So I've had those kind of occurrences in my therapy sessions as well. So my go-to strategy is when you introduce a new thing, you start to introduce it gradually. Maybe have the task at the corner of the room, and then also again giving them, preparing them in advance, telling them that we're going to do this. We're going to do this toy that you like the most, your favorite toy, and then we're going to do the new thing. And then when you start with the new toy, just give them time, and then you don't have to maybe play through the toy, play how it's supposed to. Maybe just introduce the toy first, and then introduce the parts of the toys, and then maybe in the next session when the child is more familiar to the toy, you can then try to work on your goals with the toys. Yeah.
That helps. That really helps. And one of the things I try to do with the kids when I'm having these experiences is I don't really force them. Like, I'll never force a child to finish a task. And I sometimes have parents who will apologise to me because maybe the child isn't cooperating in a session. They might be exhibiting this behaviour. And I'll just say to the parents, it's okay, because at the end of the day they're communicating to me that they don't want to do this.
Exactly.
And we're here for communication. Forget about the task.
Exactly.
The more important thing is functional communication.
Exactly.
So we do all these tasks, of course, because we do want to build those kind of more academic skills, but our main priority would be the functional communication. And if they're really saying no, and if I can get them to kind of pause for a second out of that kind of meltdown, tantrum, whatever they're having, and say like, I don't want, or something. Perfect. For me, that is wonderful communication. And there's clear intention, everything is a very clear message. So I'm like, well, let's take that as a win.
I agree with you when you say on your point, if the child don't want to do it, it's okay. It's the behavior that they're showing to us might just be the way that they communicate their emotions to us, right? So in a way, as therapists, I would always try to understand them, put myself in their place, and also respect their emotions, respect their behavior. Whatever that they're trying to do might just be their way of communicating how they feel about the toy or about the activity to us. So
and we want to respect their choice as well. Like, sometimes we don't want to do things. We're adults. We don't have to do things if we really don't want to do it. Like, of course, sometimes we do have to, if it's at work or something. But, we have that choice. We have that independence. So sometimes, I feel it's really important to respect, the choice that the child's making. I really don't want to do this. There might be a reason behind it. Maybe it's overwhelming for them. Maybe they don't like the touch. Maybe it's just because it's a new thing and you can slowly introduce it.
Exactly. And this way, we're also building good relationship with the child and have the child associate positive fun with us and about coming to therapy, about playing with us. Those kind of
Yes.
things, yeah.
I completely agree. And for us as well, like both of us, it's such an important thing for us to have the child's trust and to have a really good relationship with the child.
Yeah.
The child and the family, but most importantly, the child has to really, because they have to want to come here, There's no point in us doing these sessions if the child is screaming and crying and doesn't want to come in.
Yeah.
Because it's just going to be counterproductive, and you're going to make them work themselves up to the point where you're really causing these negative reactions, and then they're going to want to avoid therapy completely, and they're not going to, follow the instructions. They're not going to comply with everything that we want them to do. So.
And then not being able to achieve goals that way. So building relationship and rapport, not with your child, is important. Yeah.
Completely agree.